University of Virginia Children's Hospital is what we call a free-leaning children's hospital. So we provide complete care, inpatient care, we provide intensive care, we provide outpatient care, and we have extensive programs of day surgery and other kind of community outreach programs as well. But we provide it integrated with the overall University of Virginia Medical Center. So we don't have a standalone, what they call a freestanding children's hospital, but rather we have clinics and offices and inpatient units that are within the larger hospital setting.
Hospital.
So we provide all of the pediatric subspecialties, and they range in complexity from critical care and neonatal intensive care doctors. We have surgeons, we have anesthesiologists, we have radiologists, and a full complement of pediatricians. So then they include primary care pediatricians who take care of the whole child, and subspecialists who include caregivers like cardiologists and pulmonologists and nephrologists, et cetera.
They're able to help children in a way that maybe others wouldn't be.
Well, one thing to remember about Virginia is that we have our cities and population centers in the east, but to the west, we have a very rural population that is really underserved, in particular by academic health centers and high levels of care, high complexity care. And so the big medical centers in Virginia have to embrace a large geographic area, and because we are to the west and consider ourselves a medical center for the entire state of Virginia, we take very seriously our responsibility to the rural areas of the state, and in particular southern and southwest Virginia. So I am the chair of the Department of Pediatrics, and I am the pediatrician-in-chief for the Children's Hospital, which basically means the director of all the children's services for UVA.
Are changed here at UVA Children's Hospital?
Well, when they recruited me, the battle building was it was more than an idea. I think at that point there already was a commitment to move forward. We didn't have plans. They hadn't broken ground. We were still in the position of getting the community and the entire health system behind this initiative. And I think that it took shape because of the recognition that we had to expand children's services. There was a need for more providers, for higher complexity, and better integration of care. So one of the things that we encountered was that we had providers of some subspecialties who were out on the east side of town, and others who were downtown at the medical center, and others who were the west side or outside of town. And it was very hard for a family who had a child with special needs, who might need to see multiple different providers, different subspecialists. It was very hard for them to see all of them at the same time, or to have good integration of the care, right? Because if a child has special needs, the subspecialists need to talk to each other so that they know they're all on the same page and they have an integrated care plan. And if the caregivers are in different locations, and if that care is not well coordinated, then you have, first of all, it's very, very inconvenient for the family, right? And you have some of them coming from hours away. I've seen families who have driven 5 hours to come to the UVA health system. And if they have to do that for one subspecialty, one subspecialist, and then go home, and then come back the next week to see somebody else, it's tremendously inconvenient for the family, but it also leads to suboptimal care, because the caregivers are not actually coming together and talking to each other and providing a coordinated care plan. So having the battle building that allows all of the subspecialists to come together and actually be seeing the patients together at the same time in many cases, or sometimes they'll see one subspecialist and then see the next one right away. It allows the doctors to talk to each other and coordinate the care so that they're providing the best care in the most convenient setting for the family. And we think this is clearly the direction that all pediatric services around the country will have to be going in the future, and we're really excited to be getting there at the front of the wave.
Good, you said it.
Okay, so one of the roles, maybe the most important role of an academic health center in our society is to innovate, is to be the leading edge of healthcare, and that spans everything from providing advances in the quality of care to providing advances in service, healthcare delivery, and also advancing the science of care. And one of the things I think that we have not done very well as an academic community is demonstrate our worth to the people we serve, to society. And I think pediatrics is a perfect example of that. I like to tell the story that that when I was a child, if a child was diagnosed with leukemia, they had about a 90% mortality. Now, 90% of children with a diagnosis of leukemia survive. It's been a fantastic success story over the span of a generation, and I think that I don't think we tell that story very well. Another area where we've provided remarkable breakthroughs in care has been in neonatology. So a premature infant back 30 or 40 years ago would likely not survive, or if the child did survive, they might have various serious disabilities. Now, most premature babies not only survive, but have healthy childhood and healthy lives. And those advances over this over the span of these years has been because they have occurred because we conduct research at the same time that we're providing care. We're always looking for the new advances, the new care models, the new medications that we can give, new ways to manage the children so that they have better outcomes. And I think that that looking at care delivery as an opportunity to advance the quality of the care we provide has really led to these dramatic breakthroughs. Well, so the opening of this building really is a community effort. I credit the community with bringing this need to the attention of the medical center. The support of the community has been vital to providing the funding to bring this building to life, and to continuing to provide the positive energy that we've needed to move this project along. It's been a large and very complicated project, and we've needed the support of the community to get to this point. And I think it's going to be a great day for Charlottesville and Central Virginia.
Oh, geez.
No problem. Gathering thoughts. So we are the local Children's Miracle Network hospital. We serve a very large area, so we serve the entire Shenandoah Valley, of course the Charlottesville region, and counties to the south and the north. The support of the network is really vital to the missions that we pursue, and we're really grateful to them, and we're grateful to the community for continuing to support the Children's Miracle Network. Are we ready? Okay. So right now, our pediatric specialty clinics are in the University of Virginia Medical Center. They're clinics that look like all the other clinics. They look like the clinics that serve adults, and they're not big enough to accommodate all of the services that we need to provide. By moving to the Battle Building, we will have child-friendly and family-friendly spaces that really serve the special needs of children, in particular children with complex medical needs. But in addition, we'll be able to bring all of the subspecialties together all in one place. And so we'll be able to integrate the care. If a child has multiple health needs, they could see multiple providers at the same time and have multiple ancillary services that are provided. But all of this will occur in a state-of-the-art facility that is child-friendly, family-friendly, efficient, easy to get to, and will really be a quantum leap in the quality of the services we can provide. And all of this, okay. And it all occurs with the ultimate goal of providing better service for the children that we serve and for their families.
Thank you.
The Battle Building will provide a much better experience for patients and their families. And speaking as a parent myself, I know that it can be very challenging to bring a child into a healthcare facility. It can be a frightening environment. It can be very difficult to navigate and find your way around. The amenities are often not constructed with children or families in mind. And so to have a child-friendly and family-friendly environment in which to provide care provides a great leap forward for us. So for us, the Battle Building is part of our overall mission to assure all children a future that is healthier ever after.
Smile. Healthier ever after.
Okay, so what was the question again?
You just said the Battle Building, our goal with the opening of the Battle Building is
That's
to
right.
give every child their healthcare child.
Our goal with the opening of the Battle Building is to provide for all of our children a future that is healthier ever after.
Thank you.
Wonderful.
Not